for my first IV infusion. First of all, I hate doing anything live, but if my experience on lifelong anemia can help someone be more at ease as to what it is and what you need to do to take care of it will help someone, then I'm going to forego my shyness, so to speak, of doing anything live on video. Anyone that knows me knows that I do not care to speak my mind or my opinion on things. I will tell you, however, since November, I've had some very serious health issues from this anemia, to the point it could have possibly been cancer. So, with that said, after my first visit at the cancer center and then going over all of my lab work thoroughly and redoing my lab work, we are doing IV infusion therapy, which is basically today on Valentine's Day, I get a big bag of dark red hemoglobin put in my body because I am unable to get iron from nutrition or from medication. So this is the route we're taking, and hopefully it helps. We're starting with my first treatment today, and then I will have another treatment on the 21st. So when I get to the cancer center, I am going to, if they will allow me, record what's going on, and then afterwards any side effects or anything like that that I may be experiencing, and I will just let you know. They're hoping after 2 treatments that I will feel a lot better, and then I will get monitored every 4 months. So this may be something that I have to do for the rest of my life, and that's okay, because with the medical knowledge I know, being in the medical field for as long as I have, and the massive research I have done, the alternatives of what this could have been is far scarier. So my advice to anyone that has been told they are anemic is to be vigilant, do what you can to get your iron up by nutrition. If you have to take the oral medication, the B12 shots, all of that, do it. If it doesn't help, just be your own advocate. You know your body, you know when something's wrong. So anyways, I'm in the car, I'm getting ready to put my seatbelt on and head to the cancer center. So I will update as I can. Okay, I just pulled in at the cancer center. I'm going in. I had to stop and get some snacks. I'm vegan, but I'm definitely a caffeine junkie, so I just got some lightly salted potato chips and a Java Monster and a Mr. Pibb, because I'm not sure how long this will take. Due to my anxiety disorder that I already have, I'm prescribed Valium 2 times a day. I'm not going to lie, I already took my 2 before I left the house because I'm extremely nervous. I'm getting ready to go in and check in, And then, according to their policies, I'll see how much I can video while I'm in there. I'm aware I have an accent. I do live in West Virginia. No, we are not all hillbillies and rednecks. I've been all over the states. My father was in the Air Force. I was born in Alaska. I've lived in North Carolina with my husband for 5 years. We moved back here. Right now, he is battling liver disease. He's had 3 back surgeries due to the military. He served 18 years, United States Army, Reserves, and the Guard. Very proud of my veteran. However, excessive Tylenol use and an immune disorder has destroyed his liver. He is currently on the list for a transplant. He wanted very much to be with me today because he knows I'm nervous and I'm trying not to cry. But he's not having a good day, so I told him to stay home. So I'm going to gather my stuff. I brought my tablet. I've got my phone completely charged so I can play my game or do whatever to occupy time while I'm in here. Like I said, I have no idea how long this is going to take. So I will record here in a little while, depending on their privacies. Hopefully I'm in a room by myself where I can let you all see what's going on. See you in a little bit. I just had my lab work drawn, and they brought me back here, and it's depressing. It is mainly an open room over on the other side, which is where they were looking to put me. And then I knew, of course, I wouldn't be able to video anything because I would respect everyone's privacy. But they found me a little room here on the side where I'm by myself, and a curtain can be drawn. So a nurse will be with me in a moment, and then I'll have my IV. I know they have to wait for my lab work to see where my iron level is today. They do that every time before you have an infusion. I have done some research on that. So once the nurse comes in and talks to me and puts my IV in, I will give you an update as to what's going to happen. I'm in a chair, luckily, that reclines because I have some herniated disc, and sitting straight up and down for however long this will take will be absolutely miserable. So thank you for the little cubby with the reclining chair and some privacy. So I will keep you posted, and I will be back in just a little bit as soon as a nurse comes in and I know a little bit more. Alrighty. Wish me luck. Okay, the nurse just came in, did my blood pressure. My blood pressure runs normally really low, like probably 105/68. Today it's 128/78, I think she said. So I'm nervous, of course. I have this lovely heating pad that they put on your arm before they do the IV. They said it just helps putting it in. Never had that done before. Always had just the IV stuck in. So this is going to sit on my arm for a little bit, and then they'll be in to place the IV. Now, as you can see, of course, my hair has purple and platinum in it. So that's not Valentine's Day planned, but I do have pink pants on, and I have my Valentine's socks on, and my pink shoes. That was a gift from my husband, along with my perfume. It is the Burberry Brit Sheer that he got me. Smells wonderful, so I do have that. And then I'm going to have a big bag of dark red goo to help celebrate Valentine's Day. But on the bright side, I'm getting this taken care of. Hopefully everything will go okay and it will work. We're just waiting to see what my iron levels are today to determine, I guess, the amount or the strength of what they put in. I asked her a few questions and she's going to check with someone. They have two different types of the IV infusion that they do. Most insurances, love insurance, require the first one, which is obviously the one that doesn't cost as much. But my question to her was, when I come in on the 21st, if my iron levels have not improved, do they go ahead and just give me the one that they're giving me today, and then in 4 months when I come back, if there's no improvement, do they switch me to the next one? She wasn't sure. She had to ask someone else, and they will get back with me. So when I know more, I'll check in. But I'm getting ready to get all my snacks and drinks. Well, my chips, and my drinks out. And I am completely charged on my devices. And we'll just see. I just hope that doing this helps someone else. It is helping me to talk about it. I know I'm going to hate the way I sound and probably look on video, but when I was researching this, I watched another lady who went through the same process, and it gave me some comfort and knowledge, and if this can help someone else, then so be it. I will check back in a little bit. Okay, here I am. I am already hooked up. Here is my IV. Not sure if you could see all that. I'm short and my arms don't stretch that long. There's my table of my goodies. Good news is it's not going to take as long as I thought or was originally told. It actually only takes about 20 minutes for the iron to go through. Of course, the saline is in there. Side effects from this can be headaches, which, lovely, I already get headaches quite a bit, but my sister-in-law, Vicky, told me, because James my husband gets headaches and there's nothing he can take due to his liver condition for them. She had mentioned essential oils. Well, I went in recently to see my sister Debbie and was talking about that, and she actually had some, and she gave me a bottle, and it has, I guess, some peppermint in it, because you can smell the peppermint smell in it, but you just put it on your temples. And I put it right here. I think a lot of mine is tension headaches, but I do put it on my temples, and it's something to do with the smell, and it helps relieve the headaches. And it actually helps my husband, which no one knows what relief that gives me. He suffers enough. As far as this goes, and IV, I've had so many that it's no big deal for me. I have tattoos, so definitely not afraid of needles. I give myself B12 shots. I used to work at a asthma allergy clinic, and I gave flu shots and allergy shots, and I've taken blood. I'm a phlebotomist as well as a medical assistant. I've been doing this for, I don't want to tell my age, but we'll just say I've been doing it about 20 years. So that's not a big thing. And I keep saying and I'm sorry, I do have a better vocabulary than that. However, I'm just, I did it again. That's too funny. I am sitting here in the recliner, and the machine is pumping this into my body. She did say that she's had patients that have had hip replacements and any other type of metals in their body, complain that they can feel it around those areas, and it causes some discomfort. So anyone that's had hip replacement or anything like that, that could be something you would experience. Luckily, knock on wood, I've not had any of that yet. Hopefully never. So I'm going to sign off for now, and then when this is finished, they like to monitor you for a while to make sure you don't have a reaction. Apparently you can be allergic to the type that they're putting in you, and then they have to treat you for that. So let's keep our fingers crossed that I am not allergic to this, because it's Valentine's Day, and I really, really, really would like to get back home to my husband. So for now, I am going to sit here and drink my caffeine, have some lightly salted Pringles, figure out what I'm going to fix for dinner. I'm vegan, my husband's not, so it's usually I cook 2 different meals, and I will go from there. But as I said, I will update you when this is complete to let you know if I had a reaction to this, if I'm experiencing any side effects. So, like I said, fingers crossed everything goes smooth. Then I have to come back next week and do it again. Then I come back in 4 months. They will do my lab work and see where we're at. And if anything, I really hate speaking and videoing myself because I do know that I have a very, very prominent accent, and my husband makes fun of it, but that's just him. He was a linguist in the military, so he gives me a hard time, but that's okay. I love him anyways. So anyways, I'm going to sign off for now. Happy Valentine's Day. Yay me. And I will update everyone later. Bye. I am finished for today. It wasn't bad. Kind of get that metal taste in your mouth, but it's iron, and iron is a metal, so that's to be expected. I have a paper that has a list of possible side effects other than what they had told me as far as the nausea and a headache. I'm a little bit nauseated, but I also did not eat before I came. I ate a few of the chips while I was there, and it helped some, but I think more of the nausea is just where I haven't eaten, and the metal taste in my mouth is kind of gross. It wasn't bad. I've seen on YouTube other people that have had to do the IV infusions and be there for 4 to 6 hours and go 3 to 4 times a week because their iron is that low. Thankfully, I'm not at that point. In about a week, I have to have labs done to see where my iron levels are, which will be when I come back, because I come back in a week. I come back on the 21st. They will check my iron level and see where it's at. If it's increased, decreased, or stayed the same. And I guess that will determine the amount they give me at that visit. And perhaps determine if I have to come back again. So I'm hoping for good results. I'm hoping to feel better soon, especially after the second treatment. For people that don't understand anemia, especially severe anemia, it causes severe fatigue, irritability, and just all these other things that you don't realize that that's what's causing it. You know, and I jokingly told my husband the other day, I said, see, I'm not a bitch. It's the iron. My iron's too low. And we got a big chuckle out of that. But it really does. It makes you very agitated and on edge. You can't rest well, but you're so tired. As you can see, I have bags under my eyes that I normally would not have. But just getting ready this morning, you know, got up, made my coffee, took the dogs out, you know, shower, attempt to put some makeup on, attempt to do something to my hair to look halfway presentable, and I literally was wiped out. So can't wait to go home so I can rest a little bit. They do the heating pad that they put on your arm that I showed you to help the IV go in. They were so kind to leave me the heating pad because of my 3 herniated discs in my back. I was able to put that on my back. They do have heated blankets because with the saline going in as well, you get cold. Remember, because I should have known better. I've had enough IVs to know about the saline. I went to the restroom before I left the house. I live about 45 minutes away. I had 2 cups of coffee this morning, but my cups are huge. I did not go to the restroom when I got here before they got started. So I was basically stuck and miserable. So remember, always go to the restroom before they stick that IV in your arm, because you're stuck. And they are very kind here. For Valentine's Day, the radiation department made these little gifts to give out to the patients, which I thought was really sweet. Everyone here was super nice. Was very hesitant. My medical experiences going to physicians in this area have not been well. We are used to the Charlotte, North Carolina location and Beckley, West Virginia. There are a few good providers. My primary care provider is very good. My psychiatrist is very good. They are very good here. The VA here sucks, except for my husband's therapist that